Okay, Maggie, welcome back from Gaza.
Thank you.
So, for those who might be watching this interview with Maggie, my name is Maggie Hamarshi. I'm the chairman of the board of directors of PAMA. And Maggie, she will introduce herself, but has been in Gaza. She joined the second medical mission PAMA has sent to Gaza, and she went to the European hospital. She spent 2 weeks in Gaza as an ICU nurse working in the ICUs there. So this interview will be about Maggie's experience in Gaza. So we'll start with Maggie. How about you introduce yourself and tell us more about yourself?
Yeah. Hello, everyone. I'm Maggie Ogden. I'm a critical care nurse. I work in both the ICU and the emergency department, though while in Gaza, I focus most in the ICUs. I have a history and a background of working in different humanitarian contexts in low and middle income countries, disaster relief and epidemics and so on. I also have my master's degree in public health with a concentration in health systems and policy and health advocacy.
Awesome. Well, Maggie, you've been with us yesterday on a webinar that we designed it to be for future mission participants. And a couple of people asked you questions. I just put them as they are, and they were interesting to me, to say the least.
Mm-hmm.
One question was to you. Were you asked to put a hair cover like on you in Gaza? And it's a valid question. Some people who want to join our missions want to know, because they didn't know the Gaza, like it's governed by whom, and do they dictate what people wear and all that. So if you don't mind, answer this question one more time.
Yeah, of course. Yeah. Yes, before I even left, I actually reached out to a few people from PAMA just to ask them, should I cover my head? Should I cover my hair? Should I wear something out of respect? Will it be offensive to people? Will it put me at risk? Like, I didn't know what situation I was walking into. And I was told emphatically, no, that is not necessary. When I got there, I did kind of reach out again to the people the Palestinians that I was working with, that I became very close with very quickly, and said, is it offensive to you? Would you like me to cover my head? And they said no. So there wasn't at any point a point in time where I felt that I was, hopefully that I was offending anyone with not having my hair covered.
Yeah, and I don't know if you've been to PAMA events, like people when they come to PAMA events, like Palestinian girls, some put head cover, others don't. And the same in Gaza. So people might not know that, but that's why we share these kind of questions. Also, people might not know that 20% of Palestinians are Christian. So living in Bethlehem, around Bethlehem, and everywhere in Palestine, and also diaspora, Palestinians in diaspora are Christians and Muslims. So the fact we speak Arabic doesn't mean we are all Muslims.
And they made a point to say, to tell me, Maggie, we are accepting of everyone and everyone's beliefs, and I didn't feel that was just words they were saying. I could actually see that they were living that out. They embraced me and accepted me exactly as I was in my belief system, in my culture. And so, no, that I definitely saw an acceptance of everyone. Yeah.
So I want to say Gaza welcome everyone. PAMA welcomes everyone on our missions, regardless of your walk of life, religion, faith, no faith. Everybody is welcome. Very good. Another question was also the Arabic language. How did you manage in the ICU not speaking Arabic and dealing with ICU patients and your colleagues and all that?
Yeah, I think it was, another question that I asked prior to going. I said, I really want to go and be helpful. I want to go and be help to relieve the burden and not be more of a burden by not speaking the language. And, so that was my concern, is I just don't want to be a burden. And so I was assured that it would be fine. And again, I got there, and I would say it does help that I have a lot of international experience. I have a lot of experience of being in countries where I don't speak the language at all, because I kind of, you can kind of figure things out a little bit better.
Yeah.
I think that came to play a little bit, but I would say that every shift I was on, every group of doctors and nurses that I worked with, there was enough people that spoke enough English that I was able to communicate just fine. Everyone spoke at least some level of English, and there was usually at least one or two doctors or nurses that spoke, like, I would consider it perfect English. And then in terms of my communication with the patients, I was always in such a desperate need to try to talk to them, encourage them, the ones that were awake and not, not sedated, or, and so, I tried to learn a few words of Arabic. I had my little notebook that I was learning Arabic and write down every day. And so I'd pull it out and say, hold on, let me just look this up. But when I really wanted to convey something, I would just pull one of the nurses over and say, hey, can you tell this to the patient? Can you explain this to the patient? And I didn't feel that it was it wasn't frequent enough that it was annoying. I don't think to the nurses, they were more than happy to do that. And so the language was not an issue for me at all.
Yeah. So it is might be easier to connect with ICU nurses because there's a common thing you're doing together, the patient care and also the career and all that. Can you describe the difference between connecting with the ICU team versus connecting with other people, like you walk in the hallways and
Yeah, no, to be honest, actually, I don't think there was any difference, but I think that that's partly how I approach, like, when I am working in other countries or doing these things. That's sort of how I kind of approach it, is just an openness to everybody. And I think that helped. And so whether I was talking to a patient, or a family member in the hallway, or someone living in the corridor, or, someone outside that had approached me, I feel like, yes, for the people that spoke no English, all I could try to say was, hello, my name is this, what is your name? It's obviously limited, but I think you can express so much more than you realize, even without speaking the language. And so I felt that I was able to communicate my love, my support, all the things I wanted to communicate, even when I didn't have the words to use. But I felt that I was able to connect just as well with a random person in the hallway as I was with my ICU team, both doctors, both nurses, patients, families. I felt the same level of connection.
How important was it for the people of Gaza, the patients in Gaza, the ICU team, the hospital staff? How important was it for medical mission members to arrive in Gaza, come in, give them a shoulder? Can you describe it?
Yeah, it's interesting because I think that it was important to them in a different way than what people might think. I went in with two goals. I've had a very clear, thing in my mind that I wanted to provide the logistical support of helping with medical care and nursing care and all of that. But I wanted to provide the emotional support, to come alongside them, to stand beside them in solidarity, and to say, you aren't alone in this. You have people fighting with you. We are here for you. And I really wanted that equally as much. And I found it interesting that the feedback I got from every single doctor and nurse that I worked with, honestly, every single one of them told me, thank you for coming alongside us and for your emotional support, for giving us strength, for reminding that there are people out there who see us, who want to help us. And they said, you've given us strength. And I'm not making this about me, they are the incredible ones, but just the point being that we want to go in and help medically. That's what we're doing. We're a medical mission. But I think that it was really powerful for me to see that the feedback I got from them was what meant the most to them, was the emotional support. Listening to their stories of, I spent probably hours listening to each individual story of what they had lost, what they had been going through, their homes, their families, the family members that they had lost, all of it. And I think that we can't underestimate what that means, and providing that kind of just standing beside them. And so, yes, they appreciated the help of just the reduced workload and me trying to be hands with them and do things and get in there with them. They definitely appreciated that. But one of them actually specifically told me, one of the nurses, she said, yeah, we're all exhausted and we appreciate the help because we're really tired and it's a lot of work. But she said, we can do it. Like, it's hard work, but we can do it. But what we needed was the emotional support. And I felt like that was like really profound for me to hear, and a really good lesson that I want other people that come after me to remember.
It breaks my heart that it took us 3 months. Like, October, November, December,
Yeah.
nothing, no, zero chance of going in. And it was not before January 22nd that we could have sent the first medical mission. And they were received warmly, as you said, because they want people from outside, come, be with us, please. And that's what they're looking for the most, right? More than, not that they do not need the medical help, they need a lot. And what we are doing is a little of what they need. But totally agree with you. So let's talk about the situation in the hospital. I wanna talk about two aspects: the medical situation, like how dire it is, and on many aspects. But also, I'm gonna after that we talk about the humanitarian situation in the hospital and around the hospital.
Yeah.
So, what did you see, Maggie? Like the medical situation there.
Okay, so the medical situation. So let me talk specifically about the ICU, and then I can say more broadly. But yeah, in the ICU, what I saw was an ICU that is, fairly well functioning for given the context, I would say, in terms of, some supplies, some equipment, not enough, and there's a need, but, fairly well functioning. What I saw though is a adult ICU that was over half filled with children under 10 and under when I first arrived, which was a real surprise for me to see. I saw all of these children all on the ventilators, all on life support, most all of them dying, not doing well. The mortality is extremely high in the ICU, very high, disproportionately high. I saw just like, there's not a lot of infection control. I saw a lot of, infection. I saw a lot of massive wounds, all of the things that you are hearing about, like horrible burns, shrapnel injuries, crush injuries, explosive injuries, all in these, very small children. Injuries from snipers, gunshot wounds to the head, and 10-year-old. Most of these children were unaccompanied. They were now orphaned, so there wasn't anyone there holding their hand or being with them. All of these things were, definitely, a lot to kind of take in initially. I saw a complete lack of nutrition. There is no nutrition for the ICU patients at all. The hospital, I don't even think prior to October 7th had enteral feedings, the feedings that go down the feeding tube when a patient's on the ventilator. So they had been substituting with like Ensure, the supplemental Ensure drink, which isn't even the ideal thing that we would normally use in other ICUs. There's usually specific kind of like feeding. And the thing that really kind of shocked me was that there's no nutrition for any of the patients. None of the patients the entire time I was there was getting any nutrition. This is a big problem when you have patients that have massive wounds. They need high calorie, high protein. And these patients were already coming in malnourished. So these little children were already malnourished and now just, kind of starving in the hospital bed. I saw a lack of equipment, a lack of supplies. Like I mentioned, there was some things, but definitely like a deficiency in a lot of things. A lack of certain key medications that we need in the ICU that are very commonly used in the ICU. I saw a staff that is, burnout does not describe what the staff is experiencing, and we can talk about that. I think that's a separate topic, but just the ICU itself, there's actually 3 ICUs now operating in this hospital. They're way over their normal capacity. They told me that their normal ICU status is about 4 or 5 patients in their normal 12-bed ICU. that 12-bed ICU was always full, and then they had opened up 2 other ICUs. They had transformed other units into ICUs. So now we had 3 full capacity ICUs, so way over their normal capacity. So that affects obviously the amount of supplies, the equipment, and then also just the manpower, the resources, how much these people are working. In the other departments, I know that it was a very similar situation. I floated down into the emergency department several times, and that was obviously the chaos that you would expect it to be, with patients just lying on the ground and I mean, just all over the floor type of thing, and just completely crowded in, packed in, way over capacity. If you want, I can just go right into the hospital, the humanitarian part of it. So it's hard to describe in words. When I walked into the hospital, and I've been in a lot of low resource settings, a lot of very difficult, in low and middle income countries. I've seen a lot. And even for me, I think that it was one of the most surprising things that I saw. I didn't think I had mentally understood. You think, oh, displaced people and refugees and all of these things, but to walk into the hospital and the hallways are so packed in and narrow now that you can barely fit the width of a hospital bed with a patient on it, because there are like blankets and kind of tarps hanging from the ceiling, dividing these now homes, just in the lining every single hallway, every single stairwell. There is not like a square inch of space in every hallway in that hospital that is not filled with someone living. Like, this is where they are living. They are living behind this one little blanket, and they're trying to use their cook stove to make a little food. And it is dire. It is catastrophic, the humanitarian situation inside the hospital. Rooms of patients are taken over by families and who are trying to eat, live, cook in these like little hospital rooms, and then you step outside of the hospital, and actually, the people inside the hospital have it better. They at least are inside a shelter. Then you step outside of the hospital, and I'm not talking like outside the hospital grounds, just step right outside the door, and you are confronted with just tents and makeshift dwellings and just children everywhere, and just people trying to live and survive on the hospital grounds. Sanitation is obviously an issue. There's areas of sewage. There's areas of it's that in itself is a public health humanitarian nightmare. So I came back with an illness. There's a ton of illnesses, GI gastrointestinal illnesses from the sanitation issues, upper respiratory infections just running rampant because of the close quarters. There's hepatitis A. I actually cared for a young boy who actually died on my last day. He died of hepatitis A because we didn't have the proper medications and resources to care for him. He was alone and set up a tent beside an area that kind of had some sewage and got sick from that. So I think that it's a nightmare that it's hard for people to visualize. And when I first saw it, I was myself very taken back by it. So here we are in this hospital trying to care for these patients, and there's just thousands of people that are displaced. And so it's catastrophic.
Oh my God. This is, I've been to Gaza before this recent escalation. And as you said, the situation was dire even before. Yeah. It was unimaginable. Yeah. Like when I visited a Shifa hospital in July, it was calm time, you call it, and people keep saying ceasefire was before October 7. No, they're living under blockade before October 7. They've been oppressed for October 7, suffering the siege for 17 years. And at Shifa Hospital, I tackled one problem to understand the process, which is the blood cultures. Why don't the blood cultures come back fast? So we can change antibiotics, and we are ending up with multi-drug resistant bacteria in Shifa Hospital. And for those who don't know, Shifa Hospital is the best hospital in Gaza. And just to put things in context, Maggie is talking about the European hospital, but this is one of 6 remaining hospitals that are partially functional, and 30 other hospitals are totally gone, destroyed, non-functional, including the biggest 2 hospitals, Shifa and Nasser Hospital. So European Hospital is one of the remaining like small hospitals in Gaza trying to catch up and like upscale their operations. They are overwhelmed by the influx of patients and wounded. At times, supplies are at minimum. And I keep saying that Gaza used to get 500 truckloads every day, and now they are getting less than 100 a day. At times, they are consuming in a day what they used to consume in a month. So you make the calculations and understand how dire the situation is on the population level. No, but Maggie, thank you for painting that picture of the hospital. I'm going to be going in June, and to me, this is very helpful. What like you went there and came out. What do you want to tell people about one thing they don't know, or they're not being told about it the right way in the news, especially Western media? Like we both live in the US. One thing you want to correct people about.
Oh man, it's hard for me to choose one thing, but I think
go ahead. It doesn't have to be one thing.
I mean,
yeah.
I think that it is I think it is normal when you hear about anytime you hear about injustice or suffering or pain or these things that we hear about in the news anytime, even apart from Gaza. I think it is easy sometimes to disconnect from the true reality of what that means, right? So even with Gaza, right, we're hearing these numbers that are these insane numbers of 30,000 people, 40,000 people, 12,000 children, like 70,000, like it's crazy numbers. And I think that it's easy to kind of just separate yourself from the humanity of actually what that means. What I would love for people to understand is that the suffering is not just, the family members that we lost and the people that are now gone. It is every aspect of our human existence has been affected, and affected is not the right word, in such a dramatic, atrocious, horrifying way that to live every day is truly an act of resistance in and of itself, because it is every single aspect of their lives. So I was working with doctors and nurses who I want people to understand, also the Palestinians, if there's anything else that I want to try to convey that I don't think that people understand is these are people like I have never encountered anywhere in the world, anywhere that I've been in my life. And I don't say that lightly. And I don't say that flippantly or with cliche, or it is unremarkable, their faith, their courage, their strength, their love, their kindness, their generosity. It's actually like unfathomable to me that these people, in the midst of this pain and suffering that is difficult to describe, that they are so loving and kind, and to me, to everyone, to each other, to the patients. They're showing up every day to work when, some of them that I talked to had lost their entire family members, mother, father, brothers, sisters, in airstrikes while they were on shift, and they got the news and continued to work, continued to show up every day. I'm working with people that the nurses and doctors told me, we're just waiting every day for it to be our turn to die. Like, I talked to nurses that said, I feel so much stress because I don't know if when I go home from my shift, if my family will be dead, if my toddler will be dead. Like, can you imagine jobs in the healthcare industry, you know, ICU is a very tough place to work. ER is a tough place to work in the states where I work, where it's, you know, easy and I have all the supplies I need and the resources I need. But can you imagine the kind of, like, what kind of fortitude and strength is this in these people, that they can come do this job every day with that kind of stress and burden and pain and loss just hanging on them? And you know, I'm still in constant contact with all of them, and I check in with them. And you know, one of them messaged me yesterday and said last night was a terrifying night, like, because the bombs don't stop. They don't stop. And I think that that's one thing that's hard to kind of really understand when you watch the news. Like, I was there and I felt safe in the hospital, but the bombs were all through the day and all night long. It does not stop. These people have gotten zero rest. And most all of them are now displaced from the north into the south, into Rafah, living in tents. They're freezing. They have one pair of clothes, one pair of scrubs that they are wearing to work, to sleep, and on their off day. And that's all they had, because when they escaped from the north, that's all they had. Most of the nurses and doctors I'm working with were actually in Shifa Hospital or Indonesian Hospital or Nasser Hospital that came under siege. They were actually held captive in the hospitals. I was working with nurses and doctors that experienced that kind of trauma and horror. I worked with 2 nurses who were actually taken captive for 25 days and then released, like, and they still come to work, and they don't just come to work, like, they're giving every bit of themselves. And if there's anything I want people to understand, is that it's much worse than what you are seeing or thinking. It is a humanitarian nightmare, a catastrophe that is man-made. It is man-made, and it is preventable, and it is horrific. But despite that, and even in that context, you have the most brilliant, amazing group of people that I have ever encountered. And I need people to know that about the Palestinians. And if that is the only thing that anyone hears today, my friends in Gaza told me, like, please talk about us. Please tell people about us. Please tell people about what you're seeing. Please let people know. And so, yeah, that's what I would want people to know.
Thank you, Maggie. No, I appreciate all you're doing. And they miss you a lot in Gaza, you know that.
I miss them too.
Yes, we want Maggie back. I said, okay, see. So now that gets me to the question, what should we do? Like here in the US, not as healthcare workers only, as citizens of the United States of America, the most powerful country in the world, who can stop this suffering now. They can stop it now, and they can flip everything over. But what can we do? What can we do, Maggie? What should we do, or what can we do?
I would say first, speak up. Use your voice. No matter how small your voice feels, your voice is combined with millions of other voices, and together we are louder. So use your voice. Talk to your representatives. I call my congresswoman daily. I send emails. I send, like, strongly worded emails. I think that it is not just our right, but our responsibility in this situation to try to influence our government officials as much as possible, even when it feels like it doesn't matter, or my voice, my one call isn't going to matter. It does. Use your voice. Talk to the people around you. I know that this is what my friends in Gaza asked me to also say, is to talk to people around you that may not be fully informed on what's going on. Talk to people that may be misinformed. Have tough conversations. The more we are talking, the more we are helping people to understand what's truly happening in Gaza, the more that we can try to bring about change. I would say whatever your level of advocacy, join a protest, however you want, to resist or join a protest. I recommend. Donate. There are a lot of organizations like PAMA on the ground. There are a lot of Palestinian charities. There are a lot of charities that are working to kind of make a map of all of the GoFundMes in Gaza of people trying to evacuate. There's a million ways that you can donate and try to have impact. I think that the key thing is to remember that the small action that you can do actually has a ripple effect, and we cannot underestimate it. And it is our responsibility. And I think in Gaza it was difficult for me. I felt the burden of the fact that my country is contributing to this, and I was there, and I tried to I went out of my way to try to make sure that people knew that I'm fighting for you guys, and I'm trying to tell people about what you're experiencing, and that we need a ceasefire and we need to let humanitarian aid in. So I think that the more we can all just do whatever little bit that we can do, it's the very least that we can do, actually. And so I would say, if you feel afraid to have that conversation, try to dig deep for that courage, like the courage of a Palestinian, because the courage they have is pretty remarkable, and try to find some of that in yourself. And then I would also say one other key point I want to make is that after humanitarian crises like these, they don't really die down, but after kind of the acute phase of them is over, whether that means a ceasefire, after a natural disaster, there's always the period where people kind of lose interest, or it stops becoming in the forefront of people's minds, and they stop paying attention to it as much. And I would just really implore people to please keep Gaza in your mind and your heart, in terms of you're talking about it, giving, if you can go on a mission, whatever skills you have, to try to use them, because the days ahead in the future for Gaza, no one knows what that will look like, but certainly the destruction is just so widespread. The health system has collapsed, the whole thing. I would venture to say they need a lot of help right now, but I would venture to say that in the future they're even going to need more help in terms of just the development and the rebuilding and all of those things. So I would ask that to help Gaza now, and to also keep Gaza in your heart for in the future as well.
No, Maggie, I second what you said. The real work is going to be after this acute phase. Some people say, and people who donate to charities, please donate to all charities. That's better than not donating. But you might want to focus on the charities that been there before, and they're going to be there after. So yes, exactly. That's very important. I want to share with you some discussion I had with. I was in a an interfaith kind of dialogue. Like that was before Shifa was raided. And we were kind of discussing, debating in a very civil way, that I'm saying you should never compromise or touch or come close to hospitals. This is a no. If you do that, the damage is you cannot calculate the damage after that. And then the debate was no, there are whatever military activity at the hospital, there's a base, and we are going after that, not after the patients. We are going. I say, well, you can keep saying that about every single hospital, and you can keep doing the same. And if you say that about the hospital and then about the mosque, then there is no safe place in Gaza, and everything is going to be available as target. You just need to say that. So, and then I said to, it was a rabbi, I said, what if they are wrong? They go in the hospital. What if they are wrong? He said, we should hold them accountable 100%. And nobody held them accountable. And I could not imagine going after Nasser Hospital. The reason I'm saying this, I want to ask you, Rafah and invasion of Rafah is being kind of entertained, in a way, like people, Rafah. This is going to be a disaster. But what if the hospital you've been at got raided or evacuated, and the accusation will be, well, Maggie and people like Maggie don't know that there are terrorists at the hospital. There are like military people. what would you say? What would you say to them?
First of all, like, I mean, it's interesting because like the people I told you that were the majority of the people I was working with were at these other hospitals that had been raided, had been under siege. And they all just kept telling me, they said there was no one there. There was no resistance there. There was no, they know their hospitals, and they all told me the same. They all said, we're just working, we're just trying to help patients. And I would say that with the European hospital, I think that there is a sense for me when I was there that, will this hospital be the next target that Israel just decides, like that there's something going on here and we're going to target this. I would say it's not that I know all of the inner workings of the hospital, certainly, but I was in every inch of that hospital. And so from my perspective, it is crazy to me that there would be any accusation of any hospital, but it's crazy to me, certainly the hospital that I was just in for 2 weeks, that there's any kind of anything other than just thousands of displaced people and sick patients overcrowding every single one of the units I was in. That is all I saw. And so I think that there's always the excuse for action, that is just an excuse and a justification. But I know, though, that what would happen is, we've already seen, the catastrophe of sick and dying patients trying to, get out, and patients left. And then on top of that, I think of the thousands of people crowded in these hallways and just living their existence and trying to pack up and flee and evacuate again, to where, because there's no safe place. And I said it in the webinar yesterday, but I do feel like it's important to remember that, yes, I felt safe in the hospital, and I'm thankful for that safety and security. But it is a bit of a false sense of security, because for two reasons. One, anytime it could be decided that is the next target. And two, everyone that I was working with was leaving not everyone was leaving. Some of them actually still were sheltering in tents in the hospital. Some doctors I was working with, nurses, were, sheltering in the hospital because they didn't have homes. But the people that were leaving to go back to Rafah and sleep in their tents, there's zero safety, zero security. And the number of people crammed into Rafah, like, is, I can't even, it makes me physically ill to think about. It's over 1 million people, and it's crammed into such a small area. And most of these people are in tents. There's still some people living in homes, but it's just being, you hear about like the airstrikes, like, oh, there was an airstrike in Rafah. There are airstrikes all day long, all night long. It's not like it's, oh, this one you hear about on the news, and then there was, 30 others. And so a ground invasion is something that my mind I can't wrap my head around that. And especially now, I felt this way before I went, but like exponentially more now that I have faces and names, and which is what I want to try to convey, is there are faces and names and stories and people's toddlers and, people's loved ones. And they're all just crammed into these tents and just praying that it won't be them tonight that gets hit by an airstrike. A ground invasion cannot happen. And there's just no safe place. There is no safe place.
Yesterday, I was asked about the importance of the medical aid we do and all that. I just wanted, when I answered the question, because part of me feels, yes, we are doing good things. We are sending medical missions, medical supplies, but people need not to be fooled by that, because the magnitude of the disaster is way bigger than any help. And the most effective thing that needs to be done immediately is cease fire, to stop the killing, stop the influx to hospitals, let them take a break, that is the most important thing. And short of that, everything is ineffective and only a band-aid. Do you
I
agree?
I couldn't agree with you more. I feel emphatically yes. I feel that one thing you just said is exactly what I wanted to say, which is, I would tell my friends, like, try to get some rest. Like, I'll see you, like, try to get some, and they told me over and over, there is no rest. There's been no rest for 6 months. There's no rest. It is a constant bombardment, a constant fight for survival for their lives and the lives of their loved ones. And the only thing is a ceasefire. The only thing is a ceasefire. And what we're doing, yes, we are trying to help in a small way, and it is important that people help. And I support, obviously, just the very notion of a humanitarian mission. I went on one, I support it. But I think to keep in mind that it is a drop in the bucket. Even when I was there, I felt, how am I going to make any kind of an impact? How am I going to, do anything really significant in these 2 weeks? This is 2 weeks, and the patients don't stop. It does not stop. It's not like, oh, we're having a little bit of a lull in the ICU right now. It does not stop. And every single patient, well, actually, I would say 95% of them, because we kept a daily report, but 95% of the patients in the ICU at all times were conflict related. They weren't like other medical problems, because those patients aren't even, getting into the hospital. So the patients with the heart problems or the high blood pressure or so we're not even talking about that public health nightmare. Also, that as an aside, it is a non-stop barrage of patients coming in who have been under rubble, who have been bombed, who have shrapnel, who have burns. It's nonstop. And so it is important that we try to help and bring in aid and bring in our, not aid, but I mean bring in supplies and bring in equipment and bring in our manpower. But it is a Band-Aid. It is an absolute Band-Aid, and ceasefire is the only thing. And, as an aside, back to something that you mentioned earlier, like when I was driving in and we were driving to, the border, and you see miles of trucks, like, and I know other people have said this, we've all seen it online, but to see it for myself, 3 lanes deep of massive trucks that stretch for, a mile or more, 3 lanes deep of these trucks, and they've been there for weeks, and they're just sitting, and they're just sitting waiting
for the United States to airdrop and think of a port that will take 2 months, because they cannot talk to Israel to open the gate.
They're all sitting there waiting. There's just hundreds and hundreds and hundreds of trucks just sitting there waiting to come in. It's a very simple solution. We don't need to airdrop. We don't need port. We actually just need to open the border. And
the United States is not hiding that we are talking to Israel, asking them to open, but they are not. So we're going to do airdrops now. And you are giving them all the logistic help they need to do the killing, and you cannot force them to open the humanitarian corridors. This is,
and it is, and I do want to say, like, it is, in the face of the preservation of your life, or not, being humiliated, fine on the scale of things, but it is humiliating for them. It is a humiliation for the Palestinians. One of them, like I was messaging with yesterday, he's trying to evacuate. He's a physician in the ICU. He's trying to evacuate his daughter, not his daughter, I'm sorry. Yeah, his 2 daughters and his wife, who she is also a physician in the ICU. And he was the one that said it was a terrifying night. It was horrible. There were so many airstrikes there in Rafah. And so he's making the excruciating decision to try to get his wife and 2 daughters out. But one of the things, so I'm like, how can I help you? What can I do? How can I help? And one of the things he said back was, he said, we had money, we had houses. I've seen the pictures. Their homes are beautiful. For a lot of them, they had what we consider in the West, the monetary success of cars and possessions and beautiful things. And I could feel his the indignity of it, you know, when he's messaging me back and saying,
living in a tent, not securing food and warmth for his dog.
and he's having to ask for help to try to get the thousands of dollars needed in order to evacuate his 2 little toddler girls to safety. And he said, you know, it's not like we were poor before. We had money, we had cars, we had a house, we were doing well. But now, you know, I'm trying to like beg and ask for help so that I can save my daughter's lives. And yeah, I feel like just the indignity of that, and the desperation, of course, but we talk about like airdropping, you know, these things and people just trying to scramble, and you know, when it's like, we need to keep in our mind that a lot of these people were people that they're so educated, they are so intelligent, they are so educated, they had lives, they had homes, they had beautiful homes, they had all of these things, and they're being reduced to scrambling for a
equal
little.
human beings to us. They're just equal human beings to us, but they're
They
not
are.
being treated equally. They're not. I was asked, because every time I talk about the important ceasefire and the suffering of, and to me, I call it collective punishment. It is crazy what's going on.
Yeah.
And this is a description of international humanitarian organization like Amnesty International. That's how they call it. And ICJ now is looking into what's going on as a possible genocide, ICJ. But when I talk about all that, people tell me, Dr. Hamarshi, when you say ceasefire, you don't care about the hostages. I say, no, I do. I want them to go back to their families, and I feel the pain of their families waiting for them. But do not equate releasing the hostages with the ongoing killing of the children. 12,000 children killed. I'm asking to stop killing the children, and let's talk about release. Don't tell me I'm going to keep killing children till you release the hostages. The life of these hostages are not imminently in danger. You know what I'm saying?
Yeah.
They're being fed, cared for, and they're putting a formula for you to release them with some exchange, whatever. But I want to stop the killing of human beings. That's what I'm talking about. People don't understand that.
No, and whatever word you want to use to describe this, you know, if the ICJ determines that it is a genocide or not, or a war, whatever word you want to just use to describe it. I obviously have my own feelings about it, but I think that nothing justifies, absolutely nothing justifies what I'm seeing. And a ceasefire is the only thing that can be done. And I obviously want the hostages to be released, but we don't just continue murdering children in their sleep until that happens. And we don't continue starving people, starving an entire population. We don't continue indiscriminately bombing every building that we can, in every residential building, in hospitals, and we don't continue doing that until we reach terms of agreement to release hostages. We have to stop the killing. And I have such a small experience. I was there for 2 weeks compared to the 6 months of going in. But I think that I'm sorry, I think I have a bit of an echo now. But I think that what I saw in this 2 weeks, and the disproportionate number of children lying alone, dying in ICU, adult ICU, hospital bed, malnourished, starving, and in pain and dying alone, that's I saw a disproportionate amount, and that was in my small 2-week period. So I echo and agree with you that the only answer is a ceasefire. And as every day goes on and more people are starved and more people die, it's now not just the dying from bombs and these other horrific airstrikes. It is disease, it is starvation, it is things this is a man-made catastrophe, and that needs to be underscored. This is a man-made catastrophe that we can end and we need to end. It's
gonna happen, you know why? Because we're gonna send a message, me and you, to President. He's listening to us, Majdi Hamarshi from the great state of Kansas, Maggie Ogden from the great state of Washington.
Oh, yes. Yeah, we're
permanent ceasefire now, President.
oh,
That's it. Consider it done. He will listen.
consider it done. Our voices are powerful.
Yes, they are. Well, Maggie, thank you very much. It was a pleasure talking to you. And thank you for all you do. We really appreciate you in PAMA. PAMA, for those who don't know it, Palestinian American Medical Association, has been in Gaza for the last 13 years. I'm going to be in Gaza and helping the people of Gaza for years to come. Thank you, Maggie, again. Thank you.
Thank you. Thank you for the opportunity to not only go with PAMA, but also thank you for the chance to just talk about my experiences and being able to try to, elevate the Palestinian stories. I really appreciate that opportunity. And ceasefire now.
Ceasefire now. Thank you. Take care.
Thank you. Take care.
Bye.